All right, I'm Ellen Fremion, and I'm an internal medicine and pediatric doctor, so that means that I am trained both in the care of children and adults. Sometimes that name is confusing to people. And I'm at Baylor College of Medicine Transition Medicine Clinic. My clinic is a medical home for patients with special needs, so intellectual and physical disabilities due to chronic conditions from childhood. So I have some patients with adult congenital heart disease. They typically have Down syndrome or other conditions related to that congenital heart disease. This information is mainly geared to people that are planning for that transition from pediatric care to adult care. But I think that sometimes families in the community that are already in adult care have some questions about how to do their care navigation, both in the medical community as well as get community resources and funding sources for their family. So this is a very hands-on sort of information that families need to know. And I'm happy to share these slides, as I may not get to all of them in this talk, but I'm happy to share them with anybody and answer questions later. So what is healthcare transition? This is the planned process for adolescents and young adults as they change from pediatric to adult healthcare. Now, as we've heard from other providers already today, there may be those conditions that still require pediatric specialists. So the first step in transition is always to talk to your current providers and ask about expectations, about how long are they going to see me, what aspect of my care are they going to be in charge of, just so that everybody in your care team has an understanding about what everybody else is doing. Communication. So transition happens for everybody regardless of their medical conditions, but it's most challenging for people with special needs or those with congenital conditions such as congenital heart disease. The goal of healthcare transition basically is to help that young adult get the medical care that they need so that they can be all they can be. We live in a really exciting age where many of the conditions that we've talked about today used to be a death sentence to many patients and their families. Your child's not going to live for 2 weeks. Your child's not going to live to the age of 3. And now they're 30 years old, 40 years old. So they're citizens and members of our community, and we need to know how to take care of them both in the medical care world as well as in the community at large to help them to contribute to the world just like we all want to do as adults. Getting ready for transition, I often say, is like going on a trip, overseas, if you will. So the first thing you do is you have to plan. You have to take inventory of what's going on today. So you look at what supplies you need, what medications you need, what doctors you need, what about my school, what about my job, what about my finances, and all those pieces have to work together in order to have a successful transition. So we recommend at the age of 12 to 14, start talking to your medical community. So sometimes it's like that awkward first question where the doctor doesn't want to say anything because it feels like a divorce, and the patient doesn't want to say anything because they cross their fingers and hope to die that they're going to just stay with that wonderful doctor that they've had all their life. Well, we know that this can oftentimes lead to a catastrophe transition when insurance changes or the hospital says, okay, our policy is we're not going to see you after the age of 21. So we all like to prevent and plan and prepare for emergencies, and so this is the way to do it. So first question is, ask what age are you going to see my son or daughter to, and get a real definitive answer. The next question you want to ask is, so you, doc, are going to see me until age 100, but what about your partners? Is this a policy thing for your whole clinic, or is this just you? Because you take vacation sometimes, you're human, and so when I call the clinic, does that mean that they're going to say, oh, you're too old, which it has happened to many of my patients. Next, you want to ask about how can we help my son or daughter become more independent in their self-care and during office visits. This analogy is, how do we make my son or daughter the quarterback of their team? So the quarterback starts and kind of runs the play and is in charge of running the play, but they have the coach and the assistant coach and their trainers and all the players there to support them, but yet they get to take more of a leadership role in how things actually run. The next thing is, can I meet with a social worker who may be the most important person in transition planning? So here's a website, and again, I can share these slides that gives you more information about transition. The next thing is get super organized. If we're going to change anything, you have to be very planned and organized. So make a list of your healthcare team. Include their name, their contact information, what they do for you. You want to include emergency contacts within your family. What your insurance companies are, who are your suppliers, and what do they supply. And if you have a contact person within that supply group, you want to ask about that. You want to get a list of all your doctors and all your therapists, because they may be a different person in the adult community. Similar to when you go to Europe and you have to use different plugs to plug in your equipment, the same plug may not work in the adult care. You know, a GI doctor may take care of one thing in pediatric world, but the GI doctor may not take care of that aspect of your care. So it's important to get organized so that you can communicate. Make a medical summary. Sometimes this is a narrative, a life story, which tells sometimes more information than a list of all your past diagnoses and surgeries and things like that. Tell your own journey so that that new doctor can really get to know you. You want to state your medical problems, maybe the date of diagnosis, and their current therapy plan. So, for example, you have high blood pressure, and you say that was diagnosed in 2000, and then after that, list your medications and how you take them. That's clear communication to your next team. Your surgeries are important, especially if you have congenital heart disease, and you may want to list the surgeon that did that, so that way that your new doctor could contact that surgeon if they had questions. Major hospitalizations can help, especially a primary care doctor, look at those things that may lead to hospitalizations, such as every time you get a respiratory infection or pneumonia, that makes your pulmonary hypertension get out of control. So we need to have an action plan to prevent or a hospitalization, or help those hospital doctors make the adequate diagnosis and plan quickly. Medications and allergies, vaccines, and then again, any supplies you need. Take this around. This is just as important as your credit card and your driver's license, because it tells all about you and tells it in an organized way and quickly. This prevents safety issues with communicating with your new care team. This is a great website called gottransition.org. It has resources for providers, for people in transition, so adolescents, and also for their families, and gives some quick information about transition planning. Okay. So here's my 10 tips, and again, I can share this with you. As you looked over this list, you might want to raise your hand in the audience, and I'll quickly touch upon those things that are most meaningful to people. If you see something from that list, raise your hand, and I'm happy to go to that particular section.
Everybody's very shy.
Everybody's shy? I know. Speaker, ask me a question. Yeah. Yeah, a little time to read. Yes, ma'am.
I'm curious about number one.
Yes.
If you never did that as an infant, is it something that you should encourage your child to do as an adult?
So that's a great question. I think that's the most important. Okay. This is a huge conundrum to many families. So in pediatrics, you can be Medicaid eligible just based upon your family's finances alone, and not necessarily your diagnosis. So somebody that has asthma and has low income can be Medicaid eligible. Well, in the adult world, what Medicaid or SSI disability determination eligible means is the individual has a mental, a physical, or an intellectual disability such that they are not able to have employment. Because that's, in America, that's how we get our insurance, right? You get it through your employer. So you have to have an intellectual disability diagnosis. You have to have a physical disability such that you have limitations in your function. So sometimes even adult congenital heart disease does not qualify you for disability determination. And that's a huge thing for a lot of families. Yes, ma'am.
My question, I have several different problems, not just a congenital heart disease. I've had a stroke, I'm diabetic, and I'm deaf in one ear. How do you get them to take all that into consideration?
So
when I tried to get on disability, this was years and years ago, when I went back to college and I was a single parent, they were only interested in the effects of my stroke. The other three things were not even considered. one of them by themselves is not a big deal. All three together is a very big deal.
Right.
For one person.
And so it's really very difficult. And again, I think what the federal qualifications for SSI are really stipulations around your ability to work. So, for example, if your stroke made you physically unable to work, then that's where it would come into play. So there is more information. The best thing to do is not actually do this online or on the phone, is to make an appointment with the Social Security office, because sometimes that face-to-face conversation really does help advocate for you. And then also your doctor who fills out your disability form, it's really important to fill that out accurately. So it's almost even more important to do that prior to transition, so that you have your doctors who really know your history well, rather than starting it afresh with a brand new doctor that doesn't really understand what your limitations are. The ARC of Texas is an advocacy group that also has more information about this. And I want everybody, if you would write this one down, it's called Family to Family Network, all one word, familytofamilynetwork.org. It's actually a new website that I just learned about this morning, and it has many resources on it, including information about disability determination, school information, waivers, and other resources, and it's continually updated by other families, so it's a great resource. Okay. Medicaid also changes at age 21 to a managed care plan, so that's something that you would want to talk to your social worker about. There's a case manager involved in adult Medicaid that can help navigate services, so when you switch to that type of plan, you want to ask who that person is. And then there's waiver programs that are attached again to Medicaid, which is dependent upon a disability, but these offer wraparound services, which there are listed on the website, and I could talk to you more about. That Family to Family Network has all the stipulations about this spelled out on it. Insurance. So for people that are on private insurance that may have a son or daughter that has a disability, you can actually remain on your family's insurance past the age of 26. So according to the Affordable Care Act, all young adults who are not married and don't receive other insurance from their employers can stay on their family's insurance. If you have a disability, you can do a waiver through your HR department, and that individual can stay on their family's insurance lifelong. HIP is a program where you can actually get Medicaid to reimburse some of those premiums for you, so it's a good resource to know. Medicare. So this might actually be more important for people that already do work. So Medicare is a little different than Medicaid. Medicare, for all intents and purposes, works like a pension plan, aka you have to work to get a pension plan. So if somebody has worked and then say they have more complications from their congenital heart disease or whatever other disabilities that they have, and they've paid enough into Medicare withholding, they can be eligible for SSDI, which again works like a pension plan, and they can receive Medicare benefit as well. There is a situation, say that you have a son or daughter with a disability that has Medicaid and SSI on their own, and say their parent retired or became disabled themselves, and so the parent, not the child directly, but the parent receives Medicare. There actually is a way that your dependent child with a disability can also receive your Medicare benefit. So the parent's Medicare benefit goes to the child. So there's one step further, and I'm happy to talk to you about this because it is quite complicated. But sometimes that SSDI with Medicare benefit would exceed the asset limitation for the person with a disability to receive SSI. And this is where something called the Pickle Amendment comes into play. And so the most important thing about this is that if somebody does receive Medicare, secondary to their parents receiving Medicare, it can kick them off their Medicaid, but they're allowed through the Pickle Amendment to re-enroll in that Medicaid. So this is a lot of navigating, and I'm happy if somebody has this situation to, again, address this with you afterwards. So you re-enroll through the Pickle Amendment for your Medicaid. So the person with a disability is eligible for both Medicare and Medicaid. Nursing hours may be more towards special needs, but there are changes that happen between peds and adult care. Usually they are re-looked at, and adults usually receive less nursing hours than they do on the pediatric side. So that's something that families need to be prepared for. Education and employment. If somebody is in special education, they usually go to school through age 22. But there are transition planning requirements through their school. So if somebody has a disability, a learning disability in school, they have something called the individualized educational plan. And it is required by law to have a transition plan as part of that. So that means that when you have your school review, the ARDS meeting, you can request adaptive assessments and work plans for your son or daughter while they're still in public school to help them with that transition from the public school arena to whatever else is next. So that may look like a day program. It may look like sheltered workshops. It may look like actually getting them a job that they can do. So it looks like different things, but that planning needs to be in place in order for the family to navigate those resources next step. Again, there's more information through the ARC of Texas that if you need an advocate to help you with this planning and to talk with your school, there are those resources out there. The last thing is that DARS is a fantastic resource for people that have a disability. They can help you navigate to the right way for work. So they can provide supportive resources that might mean car modifications. It might look like doing more vocational and adaptive testing so that somebody has the right job or secondary education goals. So they're a wonderful resource. Consent and guardianship is definitely something difficult to navigate. So by law, when somebody turns 18, they are emancipated from their family financially and from decision making from their family. For some people that is appropriate, but for others they really do need help, and so they need guardianship, and that protects that person and helps their family still help navigate their care. This is really important and sometimes can be very costly for families, so it's important to, again, to talk to your social worker early during those early transition years, so ages 12 and 14, about what do I need to do to save up? What are the resources that you'll have for me to plan for age 18 when I might need guardianship resources? If somebody has say mild intellectual disability or just needs extra support in their care, or even might undergo a surgery where they can't make decisions for themselves, medical powers of attorney are appropriate for that person so that they understand, the person themselves has to understand that they are allowing somebody else to help them manage their care. Medical power of attorney is much less expensive. It only needs a notary to sign it rather than lawyer fees and probate court like a guardianship would be. Dental coverage, I know, is a huge issue for many adult congenital heart patients, as there's special things you need to do. The waiver programs can often help with this, or Medicare. Again, it's important to carry your medical summary around so that somebody would really know about your needs, that you would have either undergoing anesthesia or antibiotics that you would need prior to a dental procedure. It's really important for your doctors to communicate to one another on this. Lastly, there's a new thing called Community First Choice. It is different than the waiver programs. So essentially a waiver program is an extra benefit. You have to be on a waiting list sometimes in order to receive some of those services, but Community First Choice is different. It's a state program, which means that all people that meet eligibility criteria, it's like you go right in, like fast track. Community First Choice provides provider services and adaptive resources for people that need a little bit of extra help in their activities of daily living or learning how to navigate their adult world. So say they need help with money management or getting to their appointments and stuff like that. The Community First Choice can help pay for a provider that can help that adult with those adaptive needs. And you do not have to be necessarily a young adult with disability. This might be for an older adult that has adaptive care needs. This service can provide that. This is through a Medicaid sort of plan. So if you're on a managed Medicaid plan, you can ask your care coordinator to help you to access the Community First Choice services. So The ARC of Texas always is a good resource as well. They keep up to date on policy and legislature. If you have needs and you feel like your needs are not met and there's policy reform that needs to be made, I really do encourage you to contact your state senator or even your federal senator to let them know about your needs. They do want to hear from the community, and I feel oftentimes that people with disabilities or congenital conditions, as they're a new emerging adult population, oftentimes their voices aren't heard. And we really do need to pass policies that support them living in our community. So thank you very much. And again, I'm happy to share these slides with people because they are a good resource as you make your further decisions.